Hello everyone, it's Paul. This case is a sputum specimen from a 63-year-old female. She had a previous history of lymphoma and now a left lower lobe opacity. So what was your diagnosis here? Well, the specimen contained all the usual sputum components with epithelial cells, pulmonary macrophages, mucus, quite a lot of debris in this case. And the outstanding feature were the collections of hyphae. These looked different to Candida. I think I showed some yeast and little pseudo hyphae of Candida, but there was also large starburst looking collections of hyphae, and these had fairly thick septate hyphae with 45-degree dichotomous branching. There was quite a lot of them, and they didn't really look like a contaminant, seemed to be part of the specimen. There's quite a lot of it. The thing this can look like sometimes is mucor. It contains quite a number of different types of fungi, including Rhizopus. It's often large but fairly unevenly thickened non-septate hyphae usually. And it has a similar presentation to Aspergillus in that it occurs in severe immunodeficiency or uncontrolled diabetes usually. This was negative on microbiology microscopy, but confirmed on culture as Aspergillus fumigatus. This patient's history of previous lymphoma and probably treatment that resulted in immunosuppression fits with Aspergillus infection. Remember, it can present as just superficial colonization as part of allergic bronchopulmonary aspergillosis, part of a pulmonary aspergilloma, which can occur whenever there's a cavitating lesion present, and also invasive pulmonary aspergillosis, and that occurs usually in the severely immunosuppressed patients. The characteristic thing is the dichotomous 45-degree branching. You can also see fruiting heads in aerobic conditions, and the heads look a little bit like a brush, which is where the name comes from. An aspergillum brush was used apparently to sprinkle holy water. One thing to keep in mind is that when you have an aspergilloma present in a cavitating lesion, there can be a large amount of necrotic debris, some of which can look eosinophilic, orangiophilic, and degenerate. And there are cases recorded of this being misdiagnosed as invasive squamous cell carcinoma. So I hope you enjoyed that case. Thanks for watching.